How can I talk to my child?
My students need help.
I really need to talk to somebody. Is this normal?
I don't know how to respond.
What am I supposed to do?
Surely there's training somewhere to handle this.
Hello, I'm Robert Rabin, and I'm privileged to serve as the president of National Center for Youth Issues. We're delighted to have with us here today Kim Tip Frank. And Tip and I have gotten to know each other over the years and have become dear friends as we've worked together in various conferences and workshops in school systems throughout the country. And we'll be talking with Tip today about the subject of childhood and adolescent depression. And this is an area that Tip has done a lot of work in over the years, writing and presentation. And Tip, it's a real pleasure to have you with us here in Chattanooga.
Well, it's a pleasure to be here, Robert. My privilege.
Thank you. And I'd like to share a few things, Tip, about your work and your career. And Tip started his career for 7 years as an elementary and also middle school classroom teacher. And he moved from there to school counseling and has been a school counselor for the past 25 years. And Tip also maintains a very active private practice through which he counsels with children and teens on an array of behavioral health issues. And along the way, in his spare time, Tip has authored or co-authored 11 books, including Battling the Blues, which is published by National Center for Youth Issues. And also as a result of his work, he's been called upon to present at numerous workshops and conferences and school systems throughout the United States and Canada. But if you know Tip, one of the things he's the most proud of is his family, and he is a devoted husband and has 2 dear children. And again, Tip, it's a pleasure to have you with us today at National Center for Youth Issues.
Well, I'm privileged again to be here.
Well, Tip, let's just dive right into our interview. And the first question I'd like to ask you is why you chose to write a book about childhood and adolescent depression, and why is this such an important topic?
Well, the topic is huge, really, and as NCYI astutely noted, as I recall, you were getting phone calls about this topic, and you had known that I had written a book earlier on the topic, and it was time to update a book on depression, so much appreciated that you asked to begin with. But the topic is so huge because of what kids are going through today. The stress level is incredible. Kids under huge stress and situations that tend to be stressful trigger depressed and anxious feelings in kids, and we'll talk more about that later. But the numbers bear this out, Robert. About 1 in 33 kids, that's about 1 in each classroom across America, there's likely a kid there who has depression in some form or another. Of course, there's a whole continuum of degree, but that's a kid who really is hurting. If you look at the teenage side of things, it even becomes bigger. You have 1 in 8 kids, and I believe that's about 12.5% of the kids, so about 3 in every classroom for the kids 13 and older are experiencing depressed feelings, according to the National Mental Health Association. And if you look at the suicide rate, that's, Robert, where frankly it gets kind of scary. We have 5,000 kids, think about that for a minute, 5,000 kids across America that take their lives every year. These are youth that are so downtrodden with depression that they take their lives. We have 125,000 that attempt suicide. And the suicide rate has tripled since the 1960s. So it's obviously a timely topic, and it's our hope here that with the book and talking about this, and this gets the word out that we as professionals and parents and different people in the community can do a lot to spot these kids and to help.
Well, thank you for that response, Tip. And I think without a doubt the percentages that we read about and hear about certainly drive us to action as adults to help our children and youth. So thank you so much for sharing that with us. Well, Tip, the next question I'd like to ask you is, what does depression look like in our children and youth, and what signs should our parents and educators be looking for?
Well, there are several, and this is really the good news behind it, there are observable behaviors that we can see in kids, and by being aware of these, we can spot them and get them to the right kinds of places for help. One of the keys is a kid who, well, in general, kids' behaviors change, and part of that might be a real outgoing social kid suddenly becomes withdrawn. or no longer is interested in activities that he or she's been interested in the past. As kids get toward those teenage years, anger and meltdown type behaviors, and we might think, well, what's that kid so angry about? But when you see chronic anger and intense anger, that's certainly a sign. A kid that isn't focused, and we think about ADD and so forth. Obviously, ADD is chronic and pervasive for year after year, but for the depressed kid, he or she will look like a ADD kid who's almost out of the blue. They are unfocused. Grades are going down, these types of things. You would also look for behaviors that are cutting with teens, self-mutilating type behaviors, obviously a sad, hopeless affect. These are the kind of behaviors really that you're looking for, and when you see some of this tired, lethargic behavior, flat affect, these types of behaviors, you can take a look at them and say, you know what, this kid just doesn't seem right, the behaviors have changed. And again, when you're defining a problem, Robert, you're really looking at three things: the intensity, the frequency, and the duration of the problem. So if the behaviors are spiked up there, pretty intense, they're frequent, and they've gone on for more than a few weeks, even a couple weeks or so, it's worthy of a discussion, and this is where we as educators and parents need to be in good relationship with our kids, where we can ask them what's up. And if you have that kind of rapport with them, a lot of times you'll be able to ascertain what type of problem is going on, and then they're more receptive to help.
Well, thank you, Tip. And I think a key word you mentioned in your response was relationship. And I think being very observant of what's going on with our children and youth, and if you have that relationship, then you're going to be able to spot those changes that you talked about. So thank you very much for that response.
You've got to really know your kids.
Absolutely.
And that's the key. These are behaviors that have changed, and you go, what's up with that?
Yeah. Thank you.
Thank you.
Well, Tip, a question I'm sure that's in everybody's mind is, how does one become depressed?
Well, Robert, that is a good question. Sometimes just because. I know that seems like a lame answer, but when you talk to someone who's depressed, a lot of times they can't explain why. Now, some of it's situational depression. They've had a huge loss, change in their life, a divorce, a death, poverty issues, different things going on. But a lot of times there's no reason, and a lot of times we say or no reason we could think of anyway. We as adults will say, well, what do children have to be depressed about anyway? They don't have to go to work and do all this and that, but as we know, there's a lot going on with the youth, first of all. So sometimes it is environmental. As I mentioned, poverty issues. 1 in 5 kids lives in a home where alcohol is abused, the studies tell us. Divorce rate is 1 in 2. And we could spout statistics a lot, but people know what kids are going through. If you really are an educator and a parent, you see the stress level, which can trigger this. But the reason so often they're depressed is that it's not only environmental, but it is biological and hereditary. Well, let's talk about the hereditary component first. It runs in families. In fact, if you look at the twin studies, the identical twin studies, you'll see that in 70% of the cases, if one twin suffers from depression, so will the other. And the nature and nurture argument, well, what if they learn it from each other? Not necessarily. And in identical twins that have been separated, let's say across the country from each other, 67% of the time, if one twin suffers, so will the other from depression. Biologically, there's a biochemical thing going on there where the person with depression is, in their brain, is low in certain chemical substances that oftentimes needs to be strengthened medically. And we're talking about serotonin, we're talking about norepinephrine levels, and that's why oftentimes medical attention is needed. So in some, it's hereditary reasons, there are biological reasons and environmental, and they all tend to work together in this.
Tip, if you suspect that a child or teen is suffering from depression, what should a parent or educator do?
Well, this is, again, the beauty of knowing kids and having a relationship with them, Robert. The school is virtually the only institution that virtually every kid goes through school, goes throughout the school day, 8 hours a day or 7 hours, whatever it is. Sure, it seems too long for kids, but while they are there, the kids you notice what's going on with them. And if you suspect, it's just a good clearinghouse is what I'm saying, to spot these kids. And if you suspect a girl or a young man is depressed, the school counselor, of course, is a good person to start with. In saying that, though, an educator, including the school counselor, is not in the role of making a diagnosis. We'll talk about different ports of entry where people can go and get a good evaluation and get assessment and so forth in terms of depression. But a good thing to do is to a teacher alike. A lot of times I find as a school counselor, the kids will come to their teachers first. And there's a good couple questions to ask that certainly are not a formal evaluation. One is, and actually this comes from the Harvard mental health letter, they actually did a study on just how you would screen kids like this. And they found two questions rather, were especially helpful. The first one is, during the last 2 weeks, only 2 weeks, the last 2 weeks or so, have you felt down, depressed, discouraged? And the second one, over the last couple of weeks, have you been withdrawn, not going to normal activities, what have you, not speaking to friends like you would normally? And we found that if they answer even yes to one of those questions, that in 2/3 of the time they have some degree of depression. So it's almost a perfect screening tool that's simple, and you could tell the school counselor what's going on. He or she could talk to the parent, say, here's kind of what's going on. Of course, with teenagers, you want to work it out such that you're not breaking confidences and so forth. But I think skilled counselors can figure out a way to communicate with parents that this child or youth is struggling, and it'd be worthy of getting an evaluation with a professional who can do that. And we'll talk about who some of those people are as we go along.
Well, Tip, thanks for sharing that with us, and you brought up some great points in talking about the parent-teacher relationship. And if you're a parent and you notice some of these behavior changes in your child, would a good first line of defense maybe be to call the school counselor and to ask for his or her recommendations, or to see if they're seeing the same things at school that you're seeing at home?
Absolutely, and of course I'm a little biased here. I've been a counselor, as you mentioned, for a quarter of a century. I hate to admit that, but a long time. But we are probably the best people to call to begin with, because we can, number one, confirm by talking to teachers, seeing what they're seeing. Are they seeing the same types of behaviors? So the parents don't think they're crazy. They're seeing something, and the worst thing we could do is just ignore it as parents and educators. If you see something, tell someone, because the kid may be at risk. And we're talking about serious stakes here. We talked about the number of kids we lose every year through depression. So it never hurts to err on the side of caution here. The school counselor can also serve as the person who can refer to community resources, and I think we'll talk more about that later in our discussion. But there are many people in a community that can help kids, and it really the school counselor is the person who should know. Maybe the school psychologists, don't want to leave them out, should know who are the community resources, who are the go-to people who do good work with kids. A lot of people do great work with adults, but who specializes in children? Who can do play therapy? Who's a child psychiatrist or a neurologist, a family physician, a pediatrician that you know is right on target and understands what's going on with kids and can do a careful evaluation? Because that's really the next step, is once we've identified this, a referral needs to be made out to a credible person who can make that evaluation and can give us the all clear, hopefully, that it's not a big problem. But if there is a problem, it doesn't hurt to obviously address it and make sure we're good with the kid.
Thank you.
You're welcome.
Tip, what are some of the signs that a child or a youth might be suicidal, and if you suspect one is, what should you do? Well,
again, this is where we as parents and educators come in, because there are signs that we can observe. It takes a lot of attention, but you can see things, definitely. First of all, the obvious one is talk of suicide. If you have a child, Robert, that is talking about wanting to hurt themselves, you want to ask them, do you have a plan? Especially the school counselor should. A teacher could ask that too, though, because we find if they have a plan, we take it to the next level. And of course, any talk of suicide is serious, but if they have a plan, they are possibly intent on following through on this in the near future. But either way, I guess I should emphasize any talk of suicide needs to be addressed in a referral, and we'll talk about what you do when you find a person who is suicidal. It needs to be addressed, just to emphasize that point. A child or a teen giving things away, giving away possessions for no apparent reason. Accidents, the kid who shows up at the school nurse continuously, or they're having accidents and there's no good reason that's going on. Cutting, self-mutilation certainly is one. Risky behaviors, promiscuous behavior, kind of reckless behavior, having a death wish, like they don't really care if they live or die. Obviously the withdrawn behaviors, isolating themselves from friends are concerned, listless, and hopeless, flat affect. Those are things that you're looking for, Robert, and when you spot this, again, you want to get him in for an evaluation ASAP.
Well, Tip, that's excellent information, and I know that sometimes our youth, particularly a friend, may confide in them that they are thinking about committing suicide. So I guess the advice for that teen that receives that information is to respond quickly.
I am so glad you brought that up, because the students are probably going to know first. They will have friends and peers that will overhear something, and it should be mentioned in health classes and maybe counseling classes. You know, if you spot someone who looks depressed, you need to let an adult that you trust know right away, so that we can look at this. Again, we lose far too many youth every year, and not to put anyone on a guilt trip, but if you overlook it, you may miss those signs, or maybe you saw the signs but were afraid to step forward. You didn't want to get the person mad at you. That's too bad. If they're upset with you, it just shows that you care enough about that person to step forward. So I'm glad you brought that up. That's very important. And the students sometimes are the first line of defense. And again, it comes back to that relationship, doesn't it?
Yes.
If you have a good relationship, then you're able to tell an adult that you trust to handle the problem from there.
Excellent. Thank you. Well, Tip, as we're starting to wind up our interview, a couple more questions to ask. And the first one is, let's say that I am a school counselor, a building level school counselor. Mm-hmm. And we've talked a lot about the early identification of a child who may be depressed, and we've talked about the initial responses possibly, but what role can a school counselor play in the ongoing process of recovery?
We wear and again, I'm talking as a school counselor here, put my hand over my heart. We play such an important, or wear such an important hat here. One is of making a referral oftentimes, and again, the school psychologist may do this as well. But you've got to know who those people are in the community who can do good work with kids, as I mentioned earlier. It may be there's a psychiatrist who specializes in children and adolescents. A play therapist, it could be a family therapist. Families a lot of times need to understand what's going on, but a good therapist out there, a good doctor who can do good work is going to be important. So the role of being a referral expert, knowing where to send kids for help, and parents are most appreciative of this, because a lot of times they won't know, they've never been in this situation before, who in the community does good work given this type of situation. Secondly, the counselor can be the consultant or the advocate, consultant to the teacher and the advocate for the child. These are kids who will not be performing in all likelihood at the top of their game in academics, sports, the arts, whatever. They're going to be struggling, and I recommend that to teachers in this role and parents to listen to their kids, accept their kids where they are. They may be doing the best that they can right now. In my book, I mentioned something about punting. Like in football, if you don't make a first down, you punt the ball. Sometimes we'll come back to this later. We'll get the ball back later, and we'll work on those grades later, but let's get through this time and get over the depression before we can talk about going to college and other goals that the family may have for their child, or the teacher may have and child him or herself may have. So these are some of the things that we can do as being an advocate for the child, and to really let teachers kind of know what's realistic to expect. Otherwise, I think just be an encourager. We as counselors can oftentimes coordinate efforts between doctor, everyone at the school, the teachers, the principal, and so forth, so that we're doing the things that they recommend that we do to set the environment at school, as well as being an open door for that person to come and talk to us. Yes. They may have a primary therapist, but there's no reason they can't come and just get a word of encouragement from us as counselors. And we're not doing the therapy work. This is more brief counseling, of course, but just to be there, the kid knows that he or she has someone who understands their situation. So our role becomes an advocate, a good listening ear, and a great referral source in the community. Excellent. To get the helps that are needed.
Sure, well, that's a great response. And again, goes back to the relationship that's developed with the child. So thank you, Tip.
Thank you.
Well, Tip, as we're wrapping up our interview today, I have one final question for you, and that's what treatments for depression work best?
Well, Robert, keep in mind, again, these treatments, as you're calling them appropriately, are going to take place outside of the school. The school, again, will be a referral source, as we've talked about. We'll set a safety net for kids where we're making sure any child or children that are depressed are being supervised appropriately and so forth. But once it's referred out into the community, usually the two people that are going to have the most involvement in treatment are going to be a qualified physician, the medical aspect of it. It may be a child psychiatrist. It may be a pediatrician, of course, a neurologist, a general practitioner. But again, who are the people in the community that do good work with kids? Once you find those people, they will carry the ball from there and decide if medical treatment is needed. Sometimes it is, sometimes it isn't. In my practice, I get a lot of referrals from physicians, and we try the non-medicative strategies first and foremost. And a lot of times they work, but if you have a kid that's suicidal, severely depressed and so forth, sometimes without medical treatments, it's like the proverbial spitting into the wind. It's not going to work very well without it if it's a chemical imbalance. In saying that, we have to be very, very careful, though. With medications, there's been a lot of controversy, as you know. The research shows, through research such as the STAR-D program at the University of Pittsburgh, and there's been other research that shows that medication and kids can work with proper collaboration. That means between the school, the home, the counselor, therapist, what have you. So again, there's no magic pill that's going to fix a kid. There needs to be careful collaboration. That means in the treatment of this, you need therapists that are involved, the school's involved, again, to set that environment so the kids are safe. You have parents that are aware of what's going on. When you give a child medication, it needs to be understood that suicide and depression needs to be understood at this point. When a person is given medication, what happens? They start to feel better. And when a person starts to feel better, that is the riskiest time in terms of possible suicide. People will say, well, you know, he looked so good, I just saw him this weekend, he seemed happy, and then you find out on Monday he took his life. What happens so often, Robert, and the research tells us this, that a kid will start feeling better, have the energy increase, not be in the misery and malaise that he was before, but he's still not happy with life, he ends up taking his or her life. So that's why careful supervision is so important here. And what we found, if medication is given with the proper checks and balances and accountability supervision, that it oftentimes not only helps the kid, but once they get over the hump of feeling better and functioning better, the depression really does lower. But you got to get them through that time of just feeling a little bit better. When they start feeling a little bit better, watch them all the more carefully and make sure they're truly over the hump. So medication is oftentimes a necessary component of this. The doctor obviously is going to be the person most qualified to discern if that's really needed or not. Therapy is the second part of this that we mentioned. A good therapist, for children, a play therapist, that's what I do. They can work through a lot of stuff through through play media. A family therapist is part of what I do too, and that's important because the whole family needs to understand that the child doesn't like being this way, and they can do certain things within the home to set the environment. Just talk therapy, we all feel better when we talk. It helps so much. And certain therapies like behavioral activation therapy is wonderful because it gets kids out and has like homework to do. Things that they do, a little, what we call them baby steps, so to speak, to take one step after another, and then they get the reward of functioning better. And once you start getting rewards in your life, your feelings follow, is really the process of behavioral activation therapy. That is the #1 type therapy for treating people in general, let alone children and teens, with depression because it gets people active. What does the depressed person do? Nothing, very little. And there's no reward in that. When you start to interact with people and see things are improving in your life, your grades improve a little bit, you have a good time at the movies, you start feeling better. Then there's a cognitive therapy. Depressed people tend to think negatively. They can learn how to change their thoughts. Again, family therapy and play therapy work well too. So there's lots of different types of treatments, both medical and therapy-wise, that will work given enough time, and through that process, you see people really do improve. So it is not to be left here that this is a hopeless condition. It is very treatable, is what I'm trying to say, with the proper types of help.
Yes, well, that's excellent, and that's what I was thinking too. That the good news is there's hope, and we've got folks like you, Tip, that address this issue and counsel with folks not only at the school building level but in your private practice. And this is a very difficult issue, and I know at National Center for Youth Issues we receive requests quite often about materials that can help school systems deal with the issue of childhood and adolescent depression, because it is at very high levels, and it's something that all of our schools are facing. Well, Tip, you make an important point to close there, and that's the message of hope. And I think one of the things that I've heard today is that certainly depression among our children and teens is really a very predominant issue that we are facing today in our schools and in our culture, but there is hope. There are things we can do to help our children and teens in this area. And again, we thank you for being with us today. It's always a pleasure to see you, and I appreciate our friendship, and we hope you'll come by to see us again soon.
Thank you. It's been a privilege. Thank you, Robert.
Thank you. Well, let's summarize what we've learned today. The rate for youth with depression is quite high. 1 in 8 teens and 1 in 33 children are affected, yet only 1 of 3 youth receive appropriate treatment. Thus, there is a great need to identify and get help to those in need. Number 2, knowing specific signs of youth depression such as excessive anger, self-injury, and substance abuse are important to help identify these youth. Number 3, hereditary, biochemical, and environmental factors contribute to depression. Number 4, if a youth shows signs of being suicidal, an emergency evaluation needs to take place in a timely fashion, and 24/7 supervision is needed. Number 5, medication for youth with depression is often helpful. However, careful collaboration and follow-up is required. Number 6, psychotherapy, setting a healing, safe school and home environment, and sometimes medication are keys to helping youth overcome depression. If you'd like to find out more information about Tip and how to possibly bring him to your school or school district to perform a workshop or do a presentation for you at an in-service training, you may browse our website. We have a section on our website called Speakers Bureau, and you may check that out and find out more information about Tip. And also, too, we have an online catalog in which Tip's resources that he's developed are included, so we would invite you to spend some time there as well. You can call us at 1-800-477-8277, and we'd be glad to speak with you about Tip as well. Again, thank you for being with us.